Hello, welcome to Legislative Report. I'm State Representative Kate Harper of the 61st District in Montgomery County. The news has been full of stories about whether Pennsylvania will accept federal Medicaid money offered under the Federal Affordable Care Act. Recently, the Corbett administration announced that it had created a new Healthy Pennsylvania program to draw down federal dollars without expanding Medicaid, but using a different method to expand health coverage for Pennsylvanians. So joining me today to discuss the details of Healthy Pennsylvania is Bev Mackereth, Secretary of the Pennsylvania Department of Public Welfare. Welcome to the program, Bev.
Hi, Kate. Thank you. Happy to be here with you today.
Great. Our viewers don't know this, but I know you pretty well since
Yes.
we served together in the House. But I usually start out by asking our guests to say a little bit about themselves. And I think it's important for our audience to know that you're a mother and a survivor and things
Absolutely.
like that. So talk about who is Bev Mackereth.
Okay, I'd be happy to, but I don't want to take the whole program to do that. My resume it keeps getting longer and longer. But I've worked in county government. I worked in county government for 17 years. I worked beginning as a caseworker for children and youth. I worked for the district attorney's office in York for 10 years. I also was an acting Children and Youth Administrator and the Executive Director of Human Services for the County of York. I've also had opportunity to work for a health system, WellSpan Health, for a couple years. I worked for the Ridge Administration as the Deputy Director of the Governor's Community Partnership for Safe Children, a state rep for 8 years, and in my home community, I was the mayor, I was on Borough Council, and as you mentioned, the most important job is being a mom. And yes, I am also a cancer survivor, which I was diagnosed when I was in the House of Representatives.
I remember we were all stunned, but
Yeah.
you did very well and you're back.
I'm back.
Well, today we have an important subject to talk about,
Yes.
and that is, basically whether Pennsylvania should accept federal Medicaid dollars and just expand Medicaid or do something different. I understand the Corbett administration, with your help, is planning to do something different. Can you talk to us about what is Healthy Pennsylvania?
Absolutely. And I think first and foremost, we have to talk about what the goal is. And the goal is to ensure that 500,000 plus Pennsylvanians who currently do not have access to health insurance get the health insurance they need. Now, the broader program of Healthy Pennsylvania encompasses many more areas. And it's a much more comprehensive strategy. It looks at things like, do we have enough doctors? How do we keep our doctors here? It looks at ensuring that all children have access to health insurance. It looks at ensuring that communities have drop boxes to put their unused prescription drugs. It looks at public health issues. So it's much more comprehensive. The piece that I think you want to talk about today is really the piece around what are we doing about Medicaid? And I think it's important for people to note that first, you have to look at what we're doing today and how much is it costing. And Medicaid today in Pennsylvania, 1 in 6 Pennsylvanians are on this government-funded program. And Medicaid, when it was originally created, was really to be for our most vulnerable Pennsylvanians. But through the years, as with many programs, they expand in scope, and they expand in even what do we offer. And so we've gone from a program that was very clear about what it was there to do to a much broader program. And
that's today without any expansion.
That's right. That's today without any expansion. It's 2.2 million Pennsylvanians who are
out of 13 million.
Yes, who are on Medicaid. The cost of Medicaid.
But isn't that because we're a relatively old state? I've heard second in the nation number of seniors, something like that.
Yes, part of it is that. Part of it because much of Medicaid, even though people believe that or not clear about what Medicaid is, much of it goes to seniors and to people with disabilities. But there are also dollars that go to people who are economically disadvantaged. However, I think what's important to note is we spend $20 billion a year on Medicaid.
$20 billion. Well, our whole budget's $27 billion, isn't it?
Yes, 28.4, I believe.
Okay.
So you take the right, because that's the same as the DPW budget. When I talk about $20 billion, part of it is state, and the other part of it is federal dollars. So it's a state-federal match, but the state portion is 27% of the entire general fund budget, and the Department of Public Welfare budget, Medicaid makes up 75% of our budget. So just to say, we're going to take this current Medicaid structure and we are going to expand it to 500,000 more Pennsylvanians didn't make sense for the sustainability of the program.
Because it's already huge and it's
Right.
already expensive.
Exactly.
All right, so tell me, what is this Healthy PA thing?
Okay, so what we did was we said, all right, let's keep Medicaid, kind of put it in a lockbox, and let's keep it solvent. Because as you said, we have a growing number of seniors in Pennsylvania. So we want to make sure that the dollars are there to meet those needs.
Well, obviously, at the end of your life, or even when you're over a certain age, you're going to use more in medical care than you do when you're 16 or 17. That's just the way human beings work.
Absolutely. So, but if we had continued down the same path, there was no guarantee that there would be monies to meet the needs of our most vulnerable. So when the Federal Affordable Care Act came into being and the Supreme Court said states you can opt in or opt out, we decided that we didn't want to do either one, that we wanted to utilize the federal dollars and offer to those 500,000 plus Pennsylvanians who don't have health insurance, we want to offer them a private option to get health insurance.
Now, who are these folks in general? Are they poor people or working poor people? How does that, demographically, who are we looking at, this 500,000 people we want to give coverage to?
Most of these people are healthy, able-bodied individuals who are anywhere between 0 and 133% of the federal poverty level. Many of them are working. Many of them are working one job. So there's quite a few that are working more than one job, and their employer does not pay for their health care. Okay. And that's a problem. So it's a group of people that we believe will be a good pool for us to provide this coverage for, because we don't believe most of them are the most medically complex, don't have medically complex issues, but we need to make sure that they have health care. They're also a big drain on our hospital system, because and our dollars.
Are these the folks that present to an emergency room when they're not feeling well?
Absolutely, because they have nowhere else to go.
Very expensive care in an emergency room.
That's right. So they don't have a primary care physician to go to because they don't have any health insurance to pay it. So when they get sick, they go to the emergency room. When they go to the emergency room, we get tapped with those costs. The federal government, state government, and individuals also have to pay to make up for that uncompensated care.
Right. We have a line item in the budget that goes to hospitals for uncompensated care, and essentially it's the taxpayers paying for the folks who present themselves at an emergency room, and they will get care.
Right. They have to. Hospitals cannot turn people away. However, with our private option coverage, individuals will have health insurance. The health insurance will look like the national standard now, which is called the Essential Benefit Package, and that has been compared to state employees, and it's the same package. So they will have good insurance.
Pretty good coverage. Then.
Absolutely, it is. And so they will have coverage, and that will keep them out of the emergency rooms and costing us less in the long run than it does today.
Now, will they pay anything for this coverage?
There is a premium. So we've been talking about, how do we incentivize personal responsibility?
Well, if they don't have coverage now because their employers don't offer it or whatever, and they didn't buy it on their own, maybe they can't afford it.
And maybe they can't. So we're looking at a very small premium for individuals. And with that small premium, we're also looking at incentivizing good behaviors, healthy behaviors. So for instance, we have said if somebody pays their premium on time, if they fill out a health assessment, very similar to what you do when you walk into a doctor's office. So it gives us an opportunity to get a feel for the health needs of the individual. And if that person goes and gets their annual exam, then we would reduce the premium. So we're looking at a very small premium, and we haven't figured out exactly what that looks like yet. We've proposed a $13 based on what?
$13 per
individual.
Per month?
Per month. But
that's very cheap.
Well, Actually, based on what the federal government has already agreed to with other states, is probably too high. Okay. So we are looking at that. And then we will have incentives, those healthy behaviors, to bring down the costs.
Okay. So that would be a very reasonable cost for people who don't have coverage now and not through their employer and would need it.
Right. We're also looking at...
And that's what we would use federal dollars to pay for?
We would be paying for the premium, the cost of their health care, health insurance.
They would pay a small premium.
They would pay the small premium as part of the cost share. We would pay for the cost of their health insurance.
Okay, and how will we get that money, or where would that money come from?
That would be the federal dollars. Okay. The federal dollars will come to us at 100%. It's 100% for 3 years, but we will not get that up in 2014. We're looking at January of 2015.
Well, we need the approval of the federal government before we can even offer it, can't we?
Absolutely, and that's really the process that we are going through today. But also, so you know, we're also looking at how do we incentivize and give people the tools they need in order to become independent, to not need government-funded health care, and to go to work. So we're looking at our job gateway, we're looking at our career links. How do we build on that so that they can work with people on getting those job skills, and then tie that as a healthy behavior to what we're going to be asking people to do. So that's another component of that, is really trying to get people off of government roles. If people are working 2 and 3 jobs, what I've been hearing traveling around the Commonwealth is, I just want one with health care. I don't want to work 2 and 3 jobs. I would like one. And so we're looking at what can we do to help those people.
So that's unusual, isn't it? To think about employment counseling or getting a job just to get health care, although it is the reality. Many people, most people, I think, get coverage in Pennsylvania through their employer.
Exactly, and so we're looking at this. Now, this is the most controversial piece, of course, to the federal government because it has not been proposed before.
It seems a holistic approach. Look at a whole human being and say, what do you need?
Exactly.
I need health care, but I also need a job with health care.
That's right. And to get a job, I also need reading skills, or I need to go to a job training. And if we can get those people to that job training and they're doing that, all the better for everybody. So if we don't provide them with those tools, they're never going to have the skills to do what they need to do.
All right, well, that's a good place to take a quick break. The legislative report will return in just a moment. My guest today is the Secretary of Public Welfare Department, Bev Mackereth, who was a colleague of mine in the House and is talking about what Pennsylvania is going to do or hopes to do with the federal health care dollars. We'll be right back. Stay with us.
Did you know that Act 16 of 1999 honors one of the greatest leaders in the Pennsylvania House of Representatives? The Matthew J. Ryan Legislative Office Building, once known as the Capitol Annex, is located next to the main Capitol building and honors the late Speaker of the House, Matthew J. Ryan. Those who visit this building will observe the magnificent architectural designs providing eloquence and grandeur to the building. Known as one of the greatest members in the history of the Pennsylvania State House, Matthew Ryan started his career in the legislature in 1963 and was elected Speaker in 1981. His charisma and knowledge will forever be reflected in the building now named after this great legislative leader. Now you know.
Did you know that there are 6 ornate bronze chandeliers hanging in the House chamber? The 4 large chandeliers are estimated to weigh 3 tons each. Yet these iron and brass fixtures, painted in 18-karat gold, manage to dangle effortlessly. It takes 168 light bulbs to light the large chandeliers and 84 light bulbs on each of the smaller chandeliers. As you can imagine, changing the light bulbs when they burn out is far from easy. Workers must build scaffolding in order to reach their 1,450 light bulbs. Today, special, long-life, low-wattage energy-saving bulbs are used to lessen the amount of times that the light bulbs will need to be replaced. Now you know.
Welcome back to the program. I'm State Representative Kate Harper. My guest today is Bev Mackereth, Secretary of the Pennsylvania Department of Public Welfare. Our topic is the Healthy Pennsylvania Plan, which is a way to tap into the federal Affordable Care Act. Now, before we go any further, I almost can hear this. People are worried about kids being uninsured. What's Pennsylvania doing about that? We had a very successful CHIP program. Are we still running that?
Yes, as you know, we had actually, I would say, the best program in the country. In fact, we became the model program for many other states, our CHIP program. Under the Affordable Care Act, the law requires that the children who are currently in or who would be in the poverty range go to medical assistance, to MA. Governor Corbett has been fighting that. He believed that because we had such a successful CHIP program, that the children in Pennsylvania should at least have the option of remaining in the program that they're in. So what the governor proposed to the federal government was give families the option to move their children into medical assistance or to keep them in CHIP. And there will be some children who are currently in CHIP that if they're moved to medical assistance will not be able to go to the same doctor. And so our fear was...
There are some doctors who won't take medical assistance.
That's right. And so I want you to think about a young child perhaps with a serious issue, maybe cancer, and they're being told, I'm sorry, you can't see the doctor you've seen for 5 years. That might be devastating for that child and family. We didn't want that to happen. So the governor and the Secretary of Health and Human Services have been back and forth. This has been an issue that the governor has been intricately involved with. As of the end of this last week, beginning of this week, the federal government is standing firm that all children will need to transfer into MA. However,
medical assistance.
We're still asking them whether or not they would give families an option, at least for a time being, so that we can successfully transfer children.
All right, but in any event,
all children in Pennsylvania should have health insurance. There is no reason why they shouldn't. So
we take care of that. So if you know a child out there who needs health insurance, they can get it.
Yes. So whether it's CHIP or whether it's MA, every child in Pennsylvania should have health insurance.
Okay. Now, at the other end of the spectrum, seniors. How does Healthy PA deal with seniors, or does it? Because aren't they already on Medicare or Medicaid? How does it work for seniors?
For seniors, there really will be no change to the benefits.
That's good. People really don't like change.
Right. Now, part of our reform, there will be some benefit restructuring. However, for seniors, they will remain the same as they are today. And for people with disabilities, they will remain the same as they are today. Some of the other things, I think people don't realize that in our current Medicaid program, we do have limits. We probably haven't talked about them in a very long time.
Limits on how much treatment you
can
get?
Okay. Yes. And what we did was we did a thorough analysis to ensure that none of the limits that we're placing through our proposal should impact people. And if it does, there might be an outlier, they will be able to ask for an exemption and they will get it. So we had to look at that. There are no limits on, for instance, going to your primary care provider. Okay. And unfortunately, that wasn't as clear in the waiver. We're going to be fixing that. Over the last...
The waiver would be our request to the federal government to accept Healthy PA as an expansion.
Exactly. And I think, I've seen some things out there in the paper, people saying don't accept it. As they're asking for, they're saying the federal government shouldn't, it's not good enough. It really is. I think that's people who are misunderstanding, because even though we did 9 hearings and we have an article out there, you can't write out every detail. And so I would encourage, for instance, your people to give, anybody, your constituency, if they have a question, they should call, and we're happy to answer.
I have gotten some emails and some phone calls and some people stopping me, in the supermarket where I do most of my constituent service, I think. And I'm sure you remember those days, right? And they're asking me, why don't you just take the federal money? It's free money. Why don't you just take the money?
Right. And there's a couple things. Number one, it's not free money. It's our money. It's taxpayer dollars. So we have to remember that. And number two, we are going to do that, but we're going to do it in a way that keeps Medicaid solvent and sustainable for the future. And we don't want to, if we look at our demographics, and we really did our homework here, and I think that's what is important for people. We could have just come out, the governor could have said, yep, we're doing it, with no look back at what we have today and what it will mean 15, 20 years down the road. He didn't do that. He could have come out and said, no, forget it, because our Medicaid program is too robust as it is. He didn't do that either. He told us, go back and do your homework and come back to me with what makes sense. If you look at the demographics in Pennsylvania, our child population is declining. Our senior population is significantly increasing. If we don't plan for today for our seniors, then there will not be the services they need as we move forward.
Now, Bev, an enormous amount of our state budget goes through your department.
Absolutely.
I remember being stunned that about 40% of the state budget
Yes.
goes to Department of Public Welfare, another 40% goes to education.
Right.
And
You got
I
it.
didn't know that until I got here and had to grapple with a budget. And we're a balanced budget state, so we have to have the same revenue and equal expenses.
Exactly.
So how does the fact that we have demographics, as you say, we're all getting older, you and me included, how does that impact the budget?
Well, it will impact the budget greatly because services and supports for seniors, for people with disabilities, are expensive. There's no question about it. And it's not like you can provide it and people get better. I mean, when you're getting older, you continue to get older.
Right.
If you have a disability frequently, it's the entire lifespan.
Sure.
And you need different types of services. So that's part of the reason we're doing this.
So our needs are growing.
Absolutely.
As we get older and as we live longer, our needs are growing in Pennsylvania.
Exactly. And I think it's important to know, you talk about the DPW budget, 75% of our budget is Medicaid.
Okay.
So when people are out there concerned about what DPW is doing with the dollars, you hear a lot, you hear people out there talking about waste, fraud, abuse, things like that. You have to remember, 75% is on the Medicaid program.
So it's a little bit of a misnomer to say that so much of our budget, 40%, goes to welfare.
Exactly.
Goes through your department, but it's actually not welfare in the traditional sense that people would think about it.
It's health care, and
health
it's
care.
long-term
Okay.
care. And over the next year, we're going to be putting together a long-term care commission, because one of the things we did not do yet in this waiver is to look at how do we meet the needs of our seniors. We know that there's growing needs. We know that the population continues to grow. We know that the Medicaid budget, which now grows about $300 to $400 million a year for existing population, with seniors, it will continue to grow. We know that we have to do something about this. And you're going to hear a lot more about it over the next year.
All right, which is good because in Montgomery County, as I found out since I'm sitting on the Council on Aging, we're actually getting more seniors than we used to have. There's been a population shift in southeastern Pennsylvania and in York County, your home county, and other places where people have moved out of cities and into the burbs. And I represent a suburban district, and we have a lot more seniors than we had anticipated, say, 20 years ago.
Absolutely. And that's why, so back to your question, why couldn't you just expand Medicaid? Had we just taken the dollars and expanded Medicaid, we would not be able to get the reforms to make the system more sustainable, and we would not be able to ensure that the dollars would be there 20 or 30 years from now.
Okay, but let's talk about the people in the middle. Let's say the working poor, the people who'd like to be working and can't find jobs. In this terrible economy, the real unemployment rate's pretty high. And these are younger people, and they want to work, or maybe they're chronically unemployed. They just don't seem to be able to hold a job for a long time. What does Healthy PA do for those folks?
Again, for an individual, if they make $15,200, it's right around there, or less, they will be eligible for the private option coverage, where
with the very low premium that you had talked about.
With a very, very low premium or no premium. There's many exemptions to that. And so those individuals will have health insurance, which means they will get the health care they need, which will reduce the amount of uncompensated care of our hospitals and that the taxpayers have to pay for.
What about, let's just say, a family of 4? You always see that as a statistic. What's the number for them? Do you know?
It's around $30,000 for a family of 4.
It'd be hard to raise a family of 4 on $30,000.
Absolutely. And if you think of even an individual, $15,000, if you think of what rent is these days, add on a couple, heating and some of your other, maybe a car payment because you need to, or what you use for public transportation.
You probably need a car if you live in the burbs.
Right. You're absolutely right. So again, Healthy PA won't help everybody. We know that. And unfortunately, as we were traveling around, I talked to a lot of people who said, well, this is my income. Would this help me? And some it will not. But it's another step forward to ensuring that people have the health care they need to stay healthy.
All right. Now let's talk just a little bit about what is the process. You have to, Pennsylvania, Governor Corbett and yourself, you have to go to the federal government and ask for permission to do this?
Yes, it's a what's called an 1115 waiver demonstration project, which means we are saying that we will use the federal dollars in a different way than what it may have been intended for, but for the same population. And we believe the way we're doing it through a private option will be much more sustainable. So that is our hypothesis, so to speak, to the federal government. And so we lay that out. They mandated 2 hearings. We had 7 hearings, 2 webinars.
What's a webinar for those who are not familiar?
A webinar is just, it's almost like a hearing. People were able to give comment, but it's over the internet.
Okay.
So I did 2 of those, and I've been meeting with any group that wants to sit down and have the presentation. Now that we've completed that, at midnight last night, we closed the public comment period. We now will take all those comments, put it into a succinct document, make changes to the waiver based on what we heard through the hearing process, and we will get that ready to be submitted within the next, hopefully, few weeks down to the federal government. Then they have a 30-day public comment period, and through that time, we'll be working with them to come up with a decision about what this can look like for Pennsylvania.
Now, if the federal government approves of Pennsylvania's plan, when would it go into effect?
We're looking at a variety of options. We're looking at whether or not we could do a phase-in. So even if we may not be ready for certain pieces, perhaps we would be ready for others. One of the things that we're concerned about is we will need to hire more workers in order to do the work around this. By the way, if we had done just a all-out Medicaid expansion, we were looking at having to hire 2,500 to 3,000 new workers.
Wow, 2,500 to 3,000 new state employees?
New state employees, and that was another piece.
What does this plan
This
call
plan
for?
is about 700.
Okay.
So
statewide.
Statewide,
Okay.
yes. Still high, but not near as high as had we done an expansion, and also that certainly that went into our decision making as well, for the cost of what this would be to move forward. And so we're going to begin walking down that path to get operationally prepared to meet the needs of the 500,000 plus Pennsylvanians who will now have access to health insurance.
Well, I think that's a good end note, and we have to end because that's all the time we have for today's program.
Thank you so much.
My guest today has been the Secretary of the Department of Public Welfare, Bev Mackereth, and I'm State Representative Kate Harper. If you need assistance with any state government matter or anything you heard today, feel free to contact me at my local office. The address and number will be shown in just a moment. Thanks for watching. Please join me again for Legislative Report.